So anyway, more good news. We're going to change gears completely now. It's with great pleasure that I introduce these three folks to you. One who is a visitor, and if I'd ask Patrice to please come forward. Patrice Roesler, of course, is heading, of course, one, I've been an advocate for mental health for many years. I think it's something that affects everyone in North Carolina, everyone in this room, your family, some way, somehow. I think that the mental health situation, as my good friend Dave Richards will tell you here shortly, has been fragmented over the years. We're trying to get it herded back the best we can. Thanks to Leon Inman, willing to take this task, and the task force. Leon, if you would please come forward. And they're going to give you a report, but I want to introduce Dave Richards. Of course, Dave is Deputy Secretary of Behavioral Health and Department of Developmental Disabilities at the North Carolina Department of Human and Services of North Carolina. Dave has been in this business for 30 years. You'll find out he has a heart for the folks and the families who suffer from this, whether it's your family, your friends, somebody you know. Dave Richard, before he came, he took this new job, I think about a year ago, March. So he's been in this new position, but before that, go back another year after that, he was with the ARC of North Carolina for 30 years. So this is not Dave's first rodeo of working with this. So we're so glad to have him here today. Patrice is going to lead the discussion out with Leon, and Leon and Dave have worked out how they're going to give the report. But I want you to give all three of these folks a big hand. They have worked so hard on this statewide task force, and I'm going to be asking, and I've already asked President-elect Webb, because this is not going to be fixed in 1 year, not with one task force. So I've asked President-elect Webb next year to please continue this thing. You know, mental health is going to continue. We're not going to cure. We're not going to find a cure for this. So it's going to continue on, and we need to keep looking for solutions and be proactive instead of reactive. So thanks to all of these folks. And thank you, Dave, for being here. These folks are looking forward to hearing from you. And Leon Inman, I cannot thank you enough. I appreciate you, brother. And so please make welcome Patrice Roesler. This is her third day on the job with the association. She does a great job, and we appreciate it. So please welcome Patrice. Thank you.
Mr. President, I really am only here to set up the computer for Leon. Leon's going to give a brief report of the task force work over March and April, and then we will turn it over today. So, Leon, I think I've got this where you need it to be. And I'll stand right behind you in case.
Just in case I need the technical assistance, thank you, Patrice, and thank you for helping coordinate this, and a special thanks to Kelly Brown. Make sure she gets that. Thanks for coordinating all of our programs. And Mr. President, it's been an honor and a privilege to chair this task force. Thank you for your vision, and also on a lighter note, thank you for the welcome last night. When we pulled into the driveway, you sat there at the hotel, and Gary and Eddie and I were trying to decide where to go to dinner. And you said you were going to Fat Buddies, and I told the guys, I said, yeah, he may fool you on some things, but never on food. Being a kind of a health food nut, I knew we could get some tofu there. No tofu there. We gorged ourselves on ribs and pulled pork and steak, right, Mr. Executive Director? And afterwards, Mr. Beal said he wanted to go pull Cokes, and those of you who grew up out in the country, I used to pull the Coke bottles and see what was on the bottom. Unfortunately, didn't have that on the bottom, and he said we were going up to some store there, and we went up and had a small Coke, and I understand that they tell little stories in there. They do. And so I was talking to one of the guys after you walked out, and he said the story come up about who had the best dog, and you were involved in that, I understand. And one of the guys said that They asked what kind of dog he had. He said, well, let me tell you how smart my dog is. He said, recently I was cooking breakfast, realized I didn't have a loaf of bread, sent my dog down to the store, and the dog came back with that loaf of bread in his teeth, dropped it on the table, didn't tear it a bit. He said, well, that's a great dog. Second guy said he was working on a project out in the shop, realized he needed some 10-penny nails. So he sent his dog down to the store, to that local store there, and the dog came back with a bag of 10-penny nails in his mouth, dropped them on the workbench, didn't lose one. They turned to Mr. Bill and said, what about your dog? How smart is he? He said, well, I don't know how smart he is, but he runs the store down there where your dog's straight at. We went to visit over to Bill last night. Our task force met on March the 10th, and we heard from, I have to use these glasses here, magnify one or the other. There you go. Here we go. But Mary Hooper gave a history of LME and NCO, and one of the first things you learn is the acronyms involved in mental health. So I've been on our mental health task force, mental health board at Centerpoint for about 12 years now, and I still haven't figured out all the acronyms, but the transition from LME to MCO, etc. We also had 6 of our CEOs at that task force meeting: Pam Shipman from Cardinal, Betty Taylor from Centerpoint, Brian Ingraham from Smoky, Brett Melton from Partners, and Victoria Witt from Sandhills, and Brian Ingraham from Smoky. I think I may have mentioned him twice. But each one of those CEOs talked to us about what they're doing and what's going on, the coordination, the collaboration. As I heard those presentations, I spoke to several of them afterwards, and I said, I think we're getting very close to getting this thing, Mr. President. There was talk about, I think actually Mr. Ingraham talked about care coordination, collaboration. I understand at Mission Hospital, you're working on whole person care. And for the first time, I think that we're finally starting to get it at the state level. In 2002, when I went on the board at Centerpoint, we had just done the state had done a divestiture of services. Instead of direct provider could not be a direct provider of services. We had to coordinate those services out and contract for those services. So we kind of took a system that needed repair, Dave, and almost completely broke it. I really and truly think, from listening to these reports, that we're very, very close to perhaps getting it right if the state will allow us to do that. So Dave's going to bring us up to date more on that later on. We also heard from Mark Botts at the Institute of Government, again talking about some of these transitions from LMEs to MCOs, etc. And one of the things that we try to do is to look at accessibility to services, to also look at some model programs, best practices programs, if you will. And we had the opportunity at our March 10 meeting to hear from Sheriff Sam Page from Rockingham County and Larry Johnson, who's the DSS director, and talking about CIT training, crisis intervention training, to all of their officers there. And I truly think that, in your county, if you're not doing that, you really need to look closely at it. We see the law enforcement under the microscope today. There are a lot of situations, I think, that could possibly be diffused if the officers have had that crisis intervention training. I know we're not doing this in our county. We're doing the crisis intervention training. But in Rockingham County, DSS has a live person answering the phone 24/7. You know what he said? It's pretty unique. And so those officers out there have had the crisis intervention training, having the opportunity to pick up the phone and call someone in DSS to perhaps get some more some more ideas on intervention in this particular situation. And you're certainly going to cut back on the recidivism in the court system, I think, for that. So a great lesson there. This past Tuesday, April the 10th, right? April the 10th, we had our meeting in Winston-Salem. April the 14th, we had our meeting in Winston-Salem. And we again had the opportunity to look at a best practices program, a Helping Veterans Heal program, where Gary Merritt, who happens to be a good friend of mine, and others have a residential program for homeless veterans. There are 24 veterans in that program today. If you're ever in Winston-Salem, you had the opportunity, they'd love to show you that program, where those veterans are having the opportunity to, first of all, have a permanent address where they live. It's a residential program, working with Forsyth Technical College, and also with Goodwill. Working with Goodwill to get job training, job skills, in 90 day, 360-90-day program to bring those people back into society and become contributors to society instead of users of services from society. We also had, who was our DSS director who presented? Deborah Donahue from Forsyth County presented to us on social services. They're using a system of care where they're collaborating with the school system and other agencies to work with whether it be foster care or those impacted by the social services system. So we've heard some great things, Mr. President. We don't have all the answers yet, but I can assure you we're on the hunt. We're on the chase. Be glad to answer any questions before I turn it over to Mr. Richard.
Any questions for Leon on the task force and the progress? Leon, we appreciate it. Everybody in the room, not members.
Can we recognize the members on the mental health task force?
If you'll please stand if you're on that task force. We got certified people
here with us today who are on that task force. Thank you, Mr. President.
No, I thank you as president, but thank you from the entire board and across this state. We appreciate it. My friend Dave Richard was fortunate enough yesterday, I guess, he went to that to be at our mental health task force meeting in Macon County. Did a wonderful job. He heard about, we had all the providers there basically from here all the way to Cherokee County. And so we can't thank Dave Richard enough for taking time out of his very busy schedule to be here for not only for this meeting, but for yesterday's meeting. And we appreciate you, Dave, and we thank you for being here. And this room is going to give you a warm welcome, and we're anxious to hear your report. So give Dave Richard a good warm welcome.
I won't take very long, because hopefully we have a few questions and then we can get to the end and do that part. But I want to thank Commissioner Veal. I met him a couple of years ago. I've been on a podium with him several times, and I've sworn I'll never go after him again when he speaks, because it's a bad move. He has, but from all of us that have been involved in the mental health system for a long time and do that, you can't find a stronger advocate. We do appreciate that, and we certainly appreciate the leadership of Leon and the committee. But what I want to tell you for the HHS, we thank you all, and that's a sincere thank you, because we know you're on the ground, and there are so many things that you have to deal with, and we understand that the whole mental health system is one that you address every day. I was a little nervous about standing up in front of you guys, because I'm not sure what the questions would be and how you feel about the mental health system. But after watching what Kevin has to go through and navigate there, I feel way better that I'm not Kevin. So I'm pretty happy to be here. So that's a good thing. I'd asked Patrice yesterday a little bit about what we should be talking about, and she said, "Why don't you talk about where the heck we're going, right? And what do you really think this is about?" And give you some hope about we're heading in the right direction, and that we have a chance to, I think, to really get it right. And that is if we all work together to go forward. So that you heard Leon saying that we reformed and we divested everything. I've been involved, as Ronnie said, for quite a while, and I think we did as much damage as possible in our efforts at reform. And it was not because there were not good people leading that effort. There were commissioners, there were legislators, there were advocates and folks who took real interest in doing the right thing. And the vision and the principles behind the reform were all right. The problem was that we didn't execute very well. And I think that's what we've been facing for a while. And then, frankly, the other thing we did is that every time we get something close to right, we figure something else out to do to disrupt it. And that's I think the one message we keep trying to tell members of the General Assembly is that it may not be perfect today, and our system might not be the best one, but find out if you change it again, we can guarantee you that you will have a worse system. And so let's at least take the framework we're in, improve that, and not turn it over to something different again. So that's the first thing. Do no harm. Let's head in the right direction and stay there long enough for some of these things to work. What I learned, I was a guy that spent my life all doing development disability work, some connections to mental health and doing that side. But when I first took this job as mental health director of the state, I happened to be at one of your counties, in Carteret County, and listened to one of those TV shows, late at night when you flip the channels, you get the cable shows, and we all get to be on those at some time, right? So I'm listening, and the sheriff or the sheriff deputy in the county says, one of the problems with mental health, it's one of those panels about mental health, one of those problems that we have is that if you look in the phone book, and you try to, first of all, not a lot of people look at a phone book anymore, but if you look at a phone book from 2 years ago, and you try to find the people that are listed as mental health providers now, they don't exist. They've all disappeared, gone out of business, and changed. And even if you do find them, they don't really represent what you would think a mental health provider was. And it hit me pretty clearly is that one of our biggest problems is that we took the thing that was most stable in our system, which essentially was the mental health center, where everybody knew to go in communities, and we eliminated that. We destroyed it in the divestiture. And ever since then, we've been trying to recreate a system that replicates that, and we haven't achieved it. But that is the right answer. Now, the good old days weren't as good as we all like to think they were. We had a whole bunch of people that didn't get service, and we had a bunch of people that were not connected. But the truth is that most people understood where to go, because they could look up in the phone book, right, and find out where the mental health center is. Today, what we know is most people, when they have an emergency or a crisis in mental health, the place they go is the emergency department. And it clogs our hospitals, it clogs the system, and frankly, it's the worst place to get treatment. So we understand all that. That's what you're dealing with. We also know that you at the county level are paying for a whole bunch of things that we don't give you credit for, right? So when I hear people say that, well, counties aren't anying up like they used to, there's not as much money coming from counties in mental health, I try to remind people is that you're not counting everything else that they do that we don't call mental health services. Every time you have a law enforcement budget, you're spending a lot of money around it. All the other things you do around social services, you're spending a lot of money on mental health issues, even if your contribution to what was the area program, the LME, and now the LME MCO, is not growing. You're probably spending more money today than you were 10 years ago in terms of services because you spend it in prisons, jails, and law enforcement and other places. So we understand that, and we understand your commitment to this, and we want to make sure that what we do going forward is create a system and have a system that we're all working together on. Now, what I can tell you is this. We can't go backwards. So there might be people in the community come to you and say, why can't we go back to where we were? And there may be good reasons to think about that, but we can't. We're in a different world in healthcare. And frankly, you, all of us, are in the forefront of a new healthcare delivery system. We're all engaged in that. I don't know your occupations, but those of you that somehow tie to healthcare, it's rapidly changing. We often don't think about mental health as part of the healthcare system. We've got to stop that. Because it is a critical component of the healthcare system. As we know, so many people have physical ailments that are related to their mental health conditions. And the substance abuse issues that we face in our communities, co-occurring disabilities with mental illness, cause significant healthcare issues that if we don't address, we're not going to be able to afford our system going forward. So if we don't integrate and really think about mental health and whole person care in the right way, then healthcare reform, changes in healthcare across the state aren't going to take hold, and we're going to continue paying outrageous money going forward. So here's where we're trying to go. Number one is that our LME MCO system is a publicly managed care system. Now, you don't have the same relationship that you used to have with that publicly managed system, but it still is. We believe, I hope you believe, that turning our mental health system, I would argue turning our physical health system over to insurance companies to manage would not be the answer. The LME part of LME MCO is really important because it's the part that describes how they interact with you, how they relate to their social service agencies, to public health, to law enforcement, to all the other agencies and communities that they have to be a part of. It's not perfect, but that part has to stay. We believe, and I believe, that we can't continue to support as many LME MCOs as we have. Now, that's not because we think merger for the sake of merger is a good idea. I think there are two reasons for it. One is you want the best talent possible running your public managed care system. And honestly, the best way to get that to compete with the insurance company and everybody else is to be large enough. They have the efficiencies that you can hire the right people to be there. And then secondly, it's defensive. The smaller they are, the easier it is for somebody to come in and say, we no longer need them. They have to be strong enough to survive. So, fairly simple for us. Now, we say 4 is a good number. It might not be 4. It might be something else. But we have to make sure that we're large enough to have these MCOs, managed care organizations, have the covered lives they need, attract the right talent, and still be local management entities. Now, they're not local now. Ronnie tells me over and over again how far Smokey goes and that there's no way that you can be a local entity that way, and it's correct. But they sure can act local. And they will act more local than a privately managed care system. And that's really important for you to remember. Now, we may disagree as we're going forward about what's the makeup of boards and all those other things, but what we will always say is that you must have county commissioner representation on those boards. Because if you don't, then we lose local. Because you guys are it. And that's one of the most important things we can convey to people. Now, we can't go back to where we were, to where the boards are majority commissioners, the boards are smaller. You can't have a 40-county system in which you have every county commissioner represented on the board. Now, I don't know how you don't run this board. It's a trick. Kevin and the president do that, right? You do that, but it's difficult. Can you imagine trying to do that in the healthcare system? It'll never work. So you have to have reasonable-sized boards with representation of the right people on it, and it has to have county commissioners on it. So that's what we're trying to do. We're trying to make sure that this system stays the course, that we begin to build those things, as I think Leon mentioned, that really work in communities. So a couple of ideas around that so you understand what we mean by it. We talk a lot about prevention, and prevention means that sending somebody to the state hospital is the last thing you want to do. When we get somebody to the state hospital, I think we fail. Now, we need our state hospitals. Let me be clear about that. We can't afford not to have them. But we sure as heck don't need to build more. What we need to do is make sure your community hospitals have the ability, have the incentives to make sure they have inpatient units to support people that have mental health needs. Because the best thing we can do is to make sure that people that have serious mental illness are treated close to home. But more importantly than that, we need to find ways to make sure they don't show up at the hospital. We have to bring back those community-based services, those essentially walk-in clinics, what our area mental health programs were, so that people know where to go. Because everybody doesn't have to show up at an emergency department. In fact, most people never should show up at an emergency department. They should be in those community-based services and know how to get those. What we're trying to do is readjust that through an MCO system, to the Medicaid part of it, to the state-funded services that go there, so that what we're creating is a system that people know that they need it, They can get their services in their communities. They can see a doctor. They can get their meds. They can do the things that must be done. And if they need a higher level of care, that's close to home. And for those people, those rare instances where people need long-term care that have such high acuity levels that they need to be in a place like our state hospitals, that they actually can get in. Right now, that's one of the hardest things in the world to do, is get in our state hospitals, because they're packed. They're not packed because that's the only place that we can serve those folks. They're packed because we don't have the right alignment of community-based services along with our community hospitals. And that's the shift that we're trying to achieve. So, in general, just lay there and stop the questions. In general, we've set a course. And the course is based upon a lot of things that you guys have done in communities. We've brought people from across the state, and we call it crisis solutions effort. Well, that crisis solutions effort is actually how to avoid crisis. And we have providers, docs, hospitals, law enforcement, elected officials, legislators show up this meeting, and there is no disagreement about what we ought to be doing on the ground. There's disagreement about how much money we should spend, where we should spend it, how do you move that, some of the technical aspects, but about what to do, there is no disagreement. Do the things that help people early, make sure that we do everything we can to eliminate, reduce the stigma around mental illness and substance use so people seek treatment, provide it on time, follow the folks up that receive those services, and when it's absolutely needed, we have the safety net system in place for it to go to. So that's what we want to do. What we want you to do is be a partner in that. Continue to be a partner in that. You are at your local level all the time. We want to do more than we're doing with the state association. And I'm going to offer the same thing that Kevin did, and then I'll stop. Not to figure out the sales tax issue. What I'm going to offer is that if you want somebody from the department, if you want us to be there with your commissioners, just call us. We want to have that conversation with you because we believe that what we're trying to do is the right thing. And that if everybody's on the same page, we can convince our General Assembly to invest the right way, and we'll stay the course and have a system that works. I'll stop.
Just make sure we know what we heard today. You heard things today from the Secretary speaking directly to this board that you've never heard on in many, many years. Because when he came on in March of 13, you never heard about bringing it back to community base. We had, some of us, many in this room, had talked about that for a long, long time. So when Secretary Richard did take the job, the first thing he did was reach out to the folks out in the communities and say, what do you really need? You know, of course, we fought the battle about representation on boards, and he's right. With 40 counties, you can't have 72 members on a board. Even though that's what I wanted, but anyway, we wanted to be a part. County commissioners have to, because it will, regardless of the legislation, regardless of what happens to mental health, it will end up in front of your board, regardless, one way or the other. And so, we cannot thank Secretary Richard enough, not only for being here, but letting us have an opportunity to have a voice. We appreciate that very much, because we are on the front lines. They called me. One thing I want to mention before we start asking questions of Mr. Richard is the problem that we really got to tackle as a society, as commissioners, is the young folks. Your county is regularly seeing involuntary commitments to as young as 6 years old. We're seeing this county 8 years old, 10 years old, 12 years old. Why? That's a whole different subject. The point is we're seeing those involuntary commitments of children. Now, if those children don't get the proper care and the proper counseling as they move forward, the state talks about money. Imagine taking care of these kids for the rest of their adult life, and that's exactly what will happen. So you're talking about if that percentage of children is not taken care of, you're talking who knows how much money if we look toward the future. Another problem that we're facing is therapeutic foster homes. There is one Level 3 therapeutic foster home from Haywood County West. That's Commissioner Upton's county. He has the only one left. Level 3 is the top level when you go to foster care. Level 3 is where the child has to be almost constantly monitored. We had one in Macon County, now that's gone. On the other levels, we got a report yesterday that those foster homes are available. But when you get to those kids who really need at a level 3 level, they're not there. So we do have some things to work on, many things to work on. But we think we have developed not only a rapport, but a relationship with DHHS, mostly because of this gentleman right here, that we've not had before. I think Leon's task force will agree to that. So with that, I know you have questions for Dave. Every county has problems in the mental health, and Commissioner Larry Phillips has had his hand up. So, Commissioner Phillips.
Thank you, Mr. President. Thank you, Mr. Secretary, for being here. A couple of questions. One of them I think you answered, and was on, will there come a time when you will force consolidation of the LMEs? And I wrote down high probability after your remarks. Am I
I like that. That's why we go with that. Yeah.
Okay. The second thing is that I serve on Partners Behavioral Health Board. At our last board meeting, there was talk that the state is going to ask the LMEs to operate at a 2% profit margin, 2 to 4%, citing industry standards. I can tell you, Mr. Secretary, that when I came on that board, had Partners been operating at 2%, considering the delays in reimbursement from the state, that LME would have been gone. And so, could you speak to that and give me some clarity on that?
I think I don't know where. Well, I think it came through casual conversations about that. I don't think that's our intention. What we're saying to the LME MCOs is this. First of all, just so you know, is that there is a state-funded risk reserve. It's actually federally funded, that we put in 2% of the service dollars every year to help fund that risk reserve. And that risk reserve is really the managed care piece in case something catastrophic goes wrong, so that you have that money available. But we know that our LME MCOs have to have reasonable reserves. One, you're right, sometimes we're not the best payers. Two, we want people to be able to invest in things that change the system. This is the honest part about where we are. This is a new system. We had one LME MCO that's been up for 8 years, Cardinal. Everybody else is 2 years or in that neighborhood. And the same goes for us in learning how to manage a managed care system. I think we've made leaps and bounds in doing that. But one of the things we have to make sure is that our publicly managed system has the ability to have the resources aside so that they can invest and take care of those things. So I wouldn't worry too much about that. Now, one of the things we have to do is we have to look at fund balances. And so we have large fund balances, and people aren't spending the amount of money that we've been providing in the capitation, then in the following year, that capitation will go down. But that is only because that's the managed care principles, and frankly, that's part of what CMS requires us to do. What we're trying to do is minimize that reduction. And also, it's really important for the board members to know is that in the following year, you spend more. Our basis for capitation is based upon historical spending, so that there's a way to get that back, so you don't lose it forever. It's all part of this new way of doing business and creating a managed care system that has a lot of great tools that can be used. We just have to be cautious we don't do anything to hurt you.
Jim.
Dave Jimberg in Hardin County. Just a quick story. Just a few weeks after Dave took his position, he came to Hardin County and helped us get Good Hope Mental Health, a freestanding 16-bed mental health open. We've been struggling for probably 6 to 8 months trying to get it open. Within a couple of weeks after Dave coming down there, he helped us get it open. But Dave, we're still struggling. All of us want to keep mental health local. That's the best place to do it. We're still struggling in that 16 beds are set at about 85% capacity, and I know it's federal and state, but we still need more beds there. The hospitals aren't interested in it because they can't make money at it. Is there any way that you could help us expand those services? And again, I want to thank you. We thanked you a bunch of times, but thank you for what you did when you came down there, because that made all the difference in the world. But if any of you are having trouble with mental health locally,
and I want to brag a little bit on the governor's budget, because in the has 30 additional three-way beds, which are the way we expand those. There's a balance between how much you can put out there, but at least the recognition is there that we need to continue to improve that number of beds in communities. We also have had, and we don't talk about this a lot, but we've had in the past, I'm going to say past 6 months, allowed for the transfer of about 200 of our beds. I want to be clear, we're not closing or reducing any of the beds in our psych hospitals, but licensed beds that weren't being used because of the new psych hospital to private hospitals that have requested that. So there is going to be more beds coming online. The problem is that if you're a freestanding psychiatric hospital and you get above 16 beds, you can't bill Medicaid. And that's not us. That's the federal government that requires that. So we have to be cautious about how we align those beds. But we know we need more community-based hospital beds, inpatient beds. So we have a recommendation if the General Assembly approves it, and we'll at least have a few more beds that we can get out there.
One other thing about your providers in your counties, we're talking about our providers that was from our FARP 7 West, that's from Bill Upton's county all the way to Cherokee County. Our providers, and I think if you ask your providers in your counties, they'll be about the same. They work on about a 40% pro bono. In other words, 40% of the people they see, they don't get paid for. If we lose one major provider in our area where you're sitting today, we're in deep trouble. And what Commissioner Phelps' point, basically what you have in the NCO is insurance companies. They manage that. It's a huge responsibility, a huge job. But it all comes down to the providers. If we don't have good providers, if they're not reimbursed for their services, there's not a business, though we have a lot of business owners in this room, there's not a business here that can operate when you give 40% of your business for free. So that's another concern. We had that talk yesterday. And there's more to Secretary Richard's job than just mental health. He'll tell you there's a lot more to this, and it's something that touches what I never could understand. And I've said this before. It touches every family. It has touched every family in this room. It depends on how deep you look. It's just a fact. So, I want questions for David before we do it. I'm not talking. Betty Lou.
Dave, thank you very much for coming today. Betty Award from Wake County. And we have been struggling with the local hospitals over the last few years in terms of trying to provide mental health services, and nobody wants them in the emergency room, and I can understand that. But would you comment just a little bit in terms of the changes? I see that change coming back to us, but our population just keeps exploding over and over and over. With over 1 million people in our county now, we see the needs, and yet, even though we have provided those services in Lake Brook and with the mental health hospital that's there, Holly Hill has agreed to take X number of patients and have slots for us. We have just recently also partnered with the UNC School of Medicine, and you probably know this, to be able to expand our Lake Brook, which is a mental health facility. That's going on all over the state, I guess, from listening today to a lot of different people. Are we really making a headway?
I think we are. And first of all, I live in your county and have watched your great advocacy and work since I've been here. So thank you for that, Commissioner Ward. I will tell you that what we do know, and I should have said this early on, is that there is no one solution. Every one of your counties is different. The urban issues are different than rural issues, and each rural county is different than another rural county, as well as each urban county is. So we have been spending a lot of time with the CEOs of Wake, of the 3 hospitals in Wake County, along with the providers and Alliance, the LME MCO, trying to determine what is the right course to address the issues they're facing. A couple things we know is that If you compare Wake County to the number of inpatient beds that they have versus what Mecklenburg has, it's a significantly less number of beds, and that has a lot to do with Dorothy Dix Hospital having been there for years and the way that the county used that. But it's not an excuse, it just is, it's a fact. And I think part of what we've got to do is to start looking at those facts of each one of those communities. Wakebrook is a great, great facility. It happens to sit right next to the hospital emergency department. So when so many people show up in there and they're diverting, they just will walk straight across the street. And I think that's what happened that day and that weekend where frankly, Wake Med was on diversion in the emergency department, which is not something we can have happen. So we recognize that we've got a problem specific to that issue, but the solutions we're talking about statewide address that, if we can get that targeted where we're trying to go. We've asked Alliance to come up to us with very specific recommendations, as we'll get them tomorrow, to bring back to the folks from the hospitals and to the Secretary and to our members of the General Assembly to see if there are very specific things we can do to address that one issue. But every one of you face it. It is, if you have the right services in the community at the front end, if we get people to the right place, if the EMS, the Sheriff's Office don't always have to take people to emergency departments, they can take them to diversion sites, we can stop that problem. But it will take time. It doesn't happen overnight. So I do think we're making progress, but we're not going to get there. It's a constant journey.
Well, I guess 40 years ago, or I don't know, I thought it was something like that, when I was asked by the governor that was in power then to serve on this was before I became the county commissioner, anyway, to serve on a statewide committee and take a look at all of the general hospitals and bring back a report to him. Well, that sounds like a fairly easy thing to do. You know, you just go visit all of them. Well, I have to tell you that it was not an easy thing. It was a tough thing to do. And I was just telling someone last night that it's from Morganton, or today I guess, that I walked into Morganton Hospital and there sat a young man, he was maybe 18, 19 years old, and he had blood dripping from his mouth. And I thought, oh my, what is wrong with him? So I asked the person that was showing us through, what is wrong with him? And he said, well, they pulled all his teeth this morning because he bit everyone's ears off. Well, of course you can't have everyone's ears being bitten off, but somehow or another I have thought about it from that day on, about that young man who lost his teeth and his ability to chew and so many other things. But, I mean, I know that's not needed, but that's something that sort of hovers in my mind in terms of being able to look at realistically at people who actually work. The guy who was taking us through was an attendant, and he didn't see anything wrong with it. I mean, I understand that. I understand that he certainly did not want anyone else's ears bitten off. So I guess that you hear stories like that that sound so simple that you would be able to find ways to be able to identify and find a solution, but it's awfully hard.
Commissioner, what I'd say to you is that, one, we don't do that anymore, so that's a positive highlight, and we have made enormous progress. And I think part of what happens when you have these things that are highly publicized and people know about them more, it's easy to think that we haven't made progress. But we have made a lot in our treatment ability, and certainly in our ability to provide medications for individuals, and we know what to do. It really is about execution at this point, and I think that's the most important thing we can. If we can stay the course, if we can all work together, and we can execute, we can achieve results. It's never going to be perfect, but we have a real opportunity to make significant strides.
Commissioner Inman.
Dave, I agree wholeheartedly with you, and I'm sure most of all the commissioners in this room agree that we should keep the service local and community-based. It appears that the House is pretty much in line with that line of thought, but perhaps the Senate, there's a lot of talk about privatization. What's the most recent thing that you're hearing about that?
Probably hear no different than with you guys do. I know there are a lot of folks that are talking, and actually that's a good thing. I think the providers, along with certainly Senate leadership and House leadership, are having a lot of conversations with the department. And I'm an optimist. You kind of have to be, right, to be an optimist. I mean, optimist being your business, I know. I believe that we're going to find a solution that is the right solution for North Carolina, and I do believe that is a provider-led system that does not eliminate the specialty LME MCO system for this population. We can do integration and whole person care without having to have one whole check given to one provider and everybody else assumed under it. It's really about our ability to use technology and to pay attention to how to make sure that people get the supports that they need. And that, Ronnie was to say, we were right into court. That isn't just about whether or not they go to their primary care doc and a psychiatrist. It's also about the human service side of it. It's about what social services does, what all the other programs we have. Because if you don't have housing, you don't have a job, then your mental health status is not going to be where you need it as you recover. So it's all of those things combined, and we have a chance to get that right, I believe.
Thank you, Commissioner Redcow.
Hi, Ellen Redcow, Durham County. Thanks for speaking so frankly to us today. We may not like necessarily the message in terms of perhaps that we're going to have to merge again, but I appreciate you telling it as it is. Do you have a sense of what type of schedule we may be looking at in terms of the timing for further consolidation, if that's what we face?
I think we're certainly would love to see it sooner rather than later, but recognizing the complications, especially as we're waiting for a Medicaid reform bill to pass. And in a conversation with the CEO this morning, our position is until that happens, we're not going to force anything. And then it has to be logical and make sense in terms of the ability for the organizations to make that transition. I think many of you heard about the CenterPoint partners sort of taking a pause on where they're going. And our position is that if we would have kept pushing at that point in time, we would have created something that wasn't in the best interest of our citizens. I still think it's in the best interest for that merger, but we have to do it in a timing that makes sense. So I think you can count on us to be reasonable as we're going forward, but you don't want to drag it out too long because then everybody's waiting for the next step. So.
We don't want to cut the conversation short, but
can I just, again, thank you very much for letting me be here, and thank you for doing that. And again, would offer anything that we can to be there. So let us know what we can do to help.
Dave, on behalf of everybody in the room, has his handcrafted pens, and we certainly want you to have one. From the Macon County Board of Commissioners, this represents not only from the Commissioner, but from the folks of Macon County, and a lot of folks in this room. We appreciate you and what you do. We have made progress. As you can imagine, out in the West, we offered, as Bill Upton will tell you, as Connie Orr will tell you, we offered, you can't make up what we've offered psychiatrists and psychologists to come to this part of the country. And they looked at Catchment and they said, are you kidding? Hundreds of thousands of dollars we've offered them. So TelePsych has been a wonderful thing, and it's up and running, and so there are some changes on the horizon. Under Secretary Richard's leadership, I think that we can take positives away. Ellen and I have had conversations about the merger points, and it's not going to be an easy process. The Secretary will tell you that. It's not going to be easy at all. And so, but we will continue to work. There's policy, there's procedure, but there's one more P that's really important. That's called people. And that's the people that we represent. And Dave, we know you have a heart for those people, and we appreciate you, and we appreciate you coming. This is Macon County. We're a little smaller county up here in the West, and we appreciate you being here, Dave, more than you know. We appreciate you. By the way, I have checked on the ethics rule. You can take the pen because that's from one government agency to another. So I'm going to clarify that. So we got to move on. We could talk. We could probably talk about the mental health. I could for days, and so we've got to move on.